Are you considering a hysterectomy? Or do you know someone who is? If so, listen to Michelle's story about her experience, what led to it, and what came afterwards. Hi, I'm Dr. Rich, and my passion is to empower every woman with practical knowledge about the world of women's health. Today, we have in studio Michelle, who's going to share with us her hysterectomy experience. Thanks for coming to tell your story.
Thank you so much for having me, Dr. Rich.
So before we jump in, I want to take a second to answer the question, what is a hysterectomy?
I want that covered.
I thought your vagina was removed during your hysterectomy.
The uterus is different from a vagina. I still have a vagina.
So, we all love The Office, but interestingly, that is not an unheard of question. And there's some confusion about what having a hysterectomy means. So we're going to talk about that today. So the word hysterectomy is the removal of the womb or the uterus, plus or minus the cervix. You'll not be able to get pregnant after hysterectomy, but you will be able to have sexual activity once you've healed from the hysterectomy. It doesn't affect a woman's ability to have lubrication or to have an orgasm. In fact, most women have an improved quality of sexual function after the hysterectomy procedure. So the medical term total hysterectomy means the removal of the uterus and the cervix. That does not involve removal of the ovaries. That would be called a salpingo-oophorectomy, so that's a separate procedure. But many women are afraid if they have a hysterectomy, they will have all of the side effects of loss of the ovaries, including vaginal dryness and hair loss and mood changes, night sweats. But rest assured, those are symptoms that are associated with the removal of the ovaries. That wouldn't happen from just the removal of the uterus with what we will call a total hysterectomy procedure. So there can be a number of different reasons that women would have a hysterectomy. And we've done a lot of different videos on management of conditions like fibroids, which is the number one reason for hysterectomy, that are more conservative, that don't involve major surgery. For the purposes of this video, we're going to talk about just the hysterectomy procedure. So that can happen because of bleeding and pain caused by fibroids or adenomyosis or endometriosis. It can happen because of uterine prolapse. It can happen because of some kind of obstetrical emergency or complication, and about 10% of hysterectomies are actually done for cancer of either the uterus, cervix, tubes, or ovaries. So there are many different reasons that someone might need that procedure. So we have the great opportunity today to talk with my friend and patient Michelle. And why don't you share with us a little bit about your experience? What was going on with you that brought you in?
Well, actually, I had been having problems for several years, so I really wish that I had started looking into this sooner than I did, but glad I did it. But before that, I was having menstrual cycles that were so long, like 14 days sometimes. Yeah, and you know, the amount of the cycle was just, you couldn't control it. It was just hindering my entire life. I would be on vacation and have to stay in because I couldn't control what was going on. So
what was your thought around that? I mean, because a lot of people, they'll come in and I mean, you're very educated, you know, you're in the medical space, but a lot of patients come in and they just think, well, that's normal. I mean, sometimes you get older and I'll have a 14-day period. What was your thought around it?
So I at first I was like that, saying, you know, this is probably normal. I've had 3 pregnancies. Maybe things are changing now. So at first I was accepting it and just trying to deal with it. But as time went on, I was learning this is not normal. You shouldn't be doing this for, you know, half a month.
Yeah.
And so then that's when I came to see you.
Fantastic.
Yeah. So my symptoms were progressively getting worse. They started out with a heavy cycle, and then it turned into more days every month, and from 10, 14, sometimes 16, and that's when I knew that I needed to do something about it. I tried everything, so don't think I didn't try, you know, taking different hormone replacement. I had an ablation to try to make the bleeding stop completely. None of that worked, so I did my own research, went online, realized that I wanted to do a robotic procedure, and one of the best in the country was here in El Paso. So I lucked out with that and went to Dr. Rich.
Some people are afraid of having any surgery, but specifically hysterectomy, because maybe a family member had an open surgery and they were told that they were like in bed for 2 months or certainly not at work for a couple months. What was your experience?
Well, I will tell you that my mother had an open hysterectomy and was in bed for 2 months, and she actually had some complications with that. So it definitely did play into my decision to go this route, but my recovery was probably one of the most simple that I've ever been through, and I've had several surgeries. I've had 3 babies, so we all know how that goes, but this was a very simple surgery. I don't even think I felt enough pain not to be able to walk. I mean, I walked out of the hospital and I had to keep reminding myself that there was a lot being done on the inside of my body because the outside of my body was feeling great. So it's definitely an easy recovery. I was up and walking in 2 or 3 days. I don't know if I'm supposed to say that in front of my doctor, but it was a really easy recovery.
We'll let it go.
Yeah, really easy recovery.
Well, that's great. And I think the robotic technology is, well, in my opinion, the best option. I think a lot of people end up in our practice and many practices going home the same day. Quick return to normal activities, driving, back to work. What was your experience?
So it was a very quick turnaround time for myself. I did walk out of the hospital. I was out same day. I was driving about maybe day 5, which I'm probably not supposed to do either, but I was driving and I was back to work in less than 2 weeks. I mean, I felt perfectly fine. I really just, like I said, had to remind myself that I actually had some major surgery that happened. But with the robotics, it's definitely just a game changer for people who are active and they need to get back to their lives quickly with no complications. I definitely 100%.
And you say you have to remind yourself, is that because there wasn't a whole lot of pain or anything?
Right,
or?
I just had, I really just, I don't think I maybe took Tylenol for a couple days.
Wow.
But that was it. There was no discomfort. I think the biggest discomfort I had, honestly, was maybe sitting up in the morning, just kind of getting your bearing, you know, maybe a little sore, like a hard ab exercise, you know, workout, something like that. But other than that, I mean, I felt fine. There was really no pain.
That's amazing. So we normally send people home with Motrin and Tylenol with codeine. You're a super healer, like so you're
I think. I don't know.
Above and beyond. So you know, individual results may vary, but that is a fairly good description of an average recovery. I think people go home the same day. They're driving probably 5 days, back at work in 2 days. There are a few things that take longer. I mean, you know, there's no sexual activity for 2 months, and you know, we had to lay off the hard ab workouts for probably a few months. But other than that, I think what you're saying is what we hear from a lot of patients, and you know, that's why we see this value in robotics and why we've been so adamant about championing women to ask, to do the research, to find a provider that can give them the best possible outcome in the least invasive surgery.
No, I do, and it's for all the moms out there like myself who have young kids that you're driving to school, you're going to soccer, you just really think in your head, because I know I did, that I don't have time to be out this long. It's just this battle in your head. But when you find out exactly what afterwards, I mean, I feel amazing now, and I wish that I had done it sooner. But I know that as a mom, and I'm sure there's a lot of moms out there that battle the same thing, that I can't take this much time, and it's really not that much time. Like, you're okay very quickly afterwards. So
a lot of people are going to ask, what is the scarring like? What are the incisions? Can you see them? Was there a lot of scarring? Do you notice it?
No, scarring is, so mine are gone. You can't see them anymore at all. I had one in my belly button, which I never saw in the first place, and then 3 others, and they're completely gone. So if you look at me, like my abdomen, there's no scarring whatsoever. So
that's great.
Definitely a big benefit.
Well, that's all the time we have for today. Thanks for tuning in, and thank you so much for coming.
Thank you so much.
This has been an amazing experience. If you feel that something we discussed today resonates, there's someone that you know that needs to hear this information, Please hit like and subscribe and share.